Myelogram is an imaging examination that involves the introduction of a spinal needle into the spinal canal and the injection of contrast material in the space around the spinal cord and nerve roots using a real-time form of X-ray called fluoroscopy. When the contrast material is injected into the subarachnoid space, the radiologist is able to view and evaluate the status of the spinal cord, the nerve roots, and the meninges. It provides a very detailed picture of the spinal cord, nerve roots, and subarachnoid space and spinal column. The myelogram is followed by a CT scan to better define the anatomy and any abnormalities. Before the procedure, you will be taken to the radiology department and an X-ray of your neck or back will be taken. You will then be taken to the GVI lab for the myelogram procedure. You will be asked to lie on your stomach with a roll placed underneath your hips to straighten your spine. A local anesthetic is applied to numb the area to be tested. A needle is placed in your lower back. During the procedure, a fluoroscope allows the doctor to see the needle inserted into the proper position. A fluoroscope is an X-ray technique that enables the doctor to see real-time images on a TV monitor. After myelogram, you should lay flat for the remainder of the day and drink plenty of fluids. After the myelogram, you will be taken for a CT scan of your neck or back. You will then be taken to recovery room where you will be discharged after 1 to 3 hours. Your procedure will be scheduled at Gates Vascular Institute. Your procedural arrival time is 6:30 a.m. Once your procedure is scheduled, you would need to complete blood work 10 days prior to the scheduled date. If we do not receive your blood work results 5 days prior to procedure, your procedure will be canceled. If you have any questions or concerns, do not hesitate to call our office at 716-852-1977. You must have someone drive you home after the procedure. If you have any allergies, please contact our office at 716-852-1977. If you have an allergy to contrast or iodine, we can prescribe medications prior to the procedure as a precaution. Do not eat solid food after midnight on the night before your procedure. You may drink clear liquids. If you take metformin or glucophage, do not take this medication on the morning of the procedure or 48 hours afterwards. Please notify your primary care physician of the need to stop this medication. If you take Coumadin, Xarelto, Eliquis, Pradaxa, Brilinta, Plavix, or aspirin, you will be instructed to hold this medication by our nurse for a specified number of days prior to the procedure. You must obtain clearance from your primary care physician that you may stop any of these medications. If you take Lovenox, do not administer this medication for 24 hours prior to your procedure. If you take anti-inflammatory medications such as ibuprofen, Motrin, Naproxen, Aleve, Celebrex, or Mobic, do not take this medication for 7 days prior to your procedure. Please leave your valuables at home. You may be asked to remove your jewelry, partials, and dentures. Before your procedure, you will be dressed in a hospital gown and an IV line will be placed into one of your veins. This will be used to give you fluids and medications to relax you during the procedure. Most patients can be discharged home after 1 to 3 hours of observation following the procedure. Please understand that there may be unexpected delays such as hospital patient emergencies. As a result, the start of your procedure may be delayed. It is best that you plan on spending most of the day in the hospital. Test results will be sent to the referring physician. You should contact them to review these results. Do not take Compazine or other phenothiazines for 24 hours after the procedure. Do not drive or run machinery for at least 24 hours. Do not do any strenuous exercises, including swimming or lifting, for at least 24 hours. Do not take a hot bath for at least 72 hours. Do resume taking pain medications and anti-inflammatory medications when you get home. Relax and take it easy for 24 hours. Drink plenty of fluids and resume your regular diet. Keep puncture sites clean and dry. Change Band-Aid after shower and remove it after 48 hours. Two to 3% of patients may develop a headache after a myelogram. Most spinal headaches resolve on their own with no treatment. However, severe spinal headaches lasting longer than 24 hours may need treatment. To prevent a headache, drink plenty of fluids when you go home. drink a beverage high in caffeine, and take it easy for 24 to 48 hours. Call our office during regular business hours if your headache does not resolve after 24 hours.